And then also stress hormones like cortisol, high levels of cortisol can also impact T4 to T3 conversion. Again, cortisol is a anti-inflammatory stress hormone. So when your body's under lots of stress, think of you're creating a metabolic fire of inflammation. Your body's going to use cortisol to quench that fire. If you have chronic high or low levels of cortisol, that will also impact conversion of T4 to T3. Think about it this way. When your body's stressed and inflamed, it doesn't want to increase metabolism. When your body's low and chronically stressed, it does not want to increase metabolism for the same reason. So in general, you got to look at the big T4 to T3 converter issues. And then, of course, all the nutrients we talked about. If you have gut issues, guess what? All those nutrients have to go in through your diet, a healthy diet, assuming that's good, have to be broken down by good enzyme and acid levels, and have to be absorbed and assimilated as well. So if we have poor gut issues, SIBO, dysbiosis, that can be a problem. Certain bugs can also exacerbate the autoimmune response. Lots of studies showing H. pylori, blasto, can increase autoimmunity. So you got to look at the whole gamut when you have a thyroid issue. This is why most thyroid doctors will miss it. One, we have late stage indication with TSH. They're not going to look at antibodies because it doesn't allow them to prescribe a drug or a treatment that changes care. And then also, doctors stay in their lane. If they're a primary care, if they're a endocrinologist, they're not going to act like a gastro. They're not going to act like a neurologist. They're not going to act like a dietitian. They kind of stay in their lane. But really, to be a great functional medicine doctor, you have to be an ultra generalist, right? You have to be able to have a foundational understanding of endocrinology, gastroenterology, neurotransmitters, neurology, nutrition, right? Blood sugar issues, the whole 9 yards. You have to understand the whole gamut. And this is why a lot of times conventional medicine will miss some of these things, right? Hope that makes sense. Hope you guys enjoyed today's video, and it kind of gives you the ability to kind of zone back, look at the thyroid, understand the different tracks of functional medicine and conventional medicine. With functional medicine, we are looking at the overall function of the body. We are understanding, hey, we have some lab markers. We're using more sensitive metrics for labs. We're using TSH in a functional range, 0.5 to 2.5. We're using T3 and T4 within a functional range. We're looking at antibodies. If we see the functional range start to deviate, start to know, hey, something may be wrong. We're not going to let things get so out of whack where it has to be outside of the pathological range for us to start looking around. We're going to have a sensitive range, so we start picking things up sooner and not let the patient get sicker and have more problems. Hope that makes sense. We're trying to go upstream versus downstream, looking at the underlying systems, because the systems, when they're out of balance, the symptoms will manifest downstream.